Okay, Job syndrome in 3 minutes, also called Hyper-IgE syndrome, HIES. They're either going to ask you pathophys given the clinical vignette, or they're going to ask you what the clinical presentation given the pathophys is. So pathophys is pretty straightforward. You need to know that it is due to a JAK-STAT mutation, and that leads to Th17 deficiency, and then that leads to impaired neutrophil recruitment with decreased interferon gamma. So make sure you know what Th17s do, and as well as how they're related to neutrophil recruitment. Here's the acronym that I use, FATED, F-A-T-E-D. I know it's in the first aid, but I also underlined F-A because I added 2 things to this. So I remember that F and A, the first 2, are something additional. So faces are coarse, fractures of bones easily, abscesses are cold, usually staph infections, abnormal neutrophil chemotaxis, teeth are retained, eosinophils with hyper-IgE, of course, and dermatological findings. Quick fact, average age of death is going to be 29 years old due to infection. So here you're seeing your fractured bone on the right, left is the faces are coarse, A, abscesses are cold. This is a common thing that I've seen in textbooks and in a couple of clinical vignettes. They're particularly around the head area, so that can be looking like a folliculitis or something like that, but it's actually could be a sign of Job syndrome. And here you can see your banded neutrophil. Again, this guy actually has pretty coarse faces, but what you're looking at here are the teeth problems, right? Retained teeth. So they're going to have either a double layer or some form of teeth abnormality. What's this? Your eosinophil, right? You're going to have elevated eosinophils with increased IgE. This is the classic finding for the dermatological findings in Job syndrome. It's going to be eczematous rash with pruritus, so they're going to have itchy rash as well.